So here we are watching a case of serous otitis media of left ear, for which we have planned an endoscopic placement of grommet in the anterior-inferior quadrant of the membrane. So in this video I will demonstrate the endoscopic placement of the grommet. First we are washing the ear canal, so to get rid of any debris or wax. Then for the fogging, we are using the Savlon to prevent the fogging. Then I will use a Myringotomy to create a radial incision in the anterior-inferior quadrant of the TM. As soon as I make an opening, you can see the discharge coming out of the eardrum. Ideally, we will suction the discharge as much as we can. The remaining of the discharge will come on its own via the ventilation tube. Try to avoid any damage to the TM due to the suction. So it is advisable not to insert the suction via the opening, as it will create a round opening of the TM, which may hamper the healing. So be very careful while suctioning the middle ear. At the same time, try to get rid of as much as discharge as possible. So there was a lot of discharge present in the middle ear, which caused the bulging of the TM. The patient had a moderate conductive hearing loss and was having a feeling of heaviness in the ear. So here we are introducing the grommet. We can use a pick for the advancement of the grommet. We can also use the repositor, as the pick is sharp and the beginner friends cannot use it properly, so it will cause trauma in the canal or on the TM. So we can also use the blunt instruments like the plaster knife or the flag knife or a repositor. Now our aim is to push the grommet through the opening, and as you can see the technique, this is how you insert a grommet. It is a very easy and a very fast job, and it will give you result instantly. The patient was satisfied. The patient was able to hear a lot better after the insertion of the grommet. The grommet will extrude on its own after a few months, and we will keep the patient on a regular follow-up. After the insertion of the grommet, we can also introduce the suction through the grommet opening, but we have to be careful not to displace the grommet into the middle ear or extrude from the tympanic membrane. We have to use a very small suction, approximately 22 or 24 size, which is the smallest. Now you can see the discharge which will come out. So this is for this video. Thank you for watching.